A very good morning to all of you. Today we are addressing the pressing global health issue of birth defects. The World Health Organization is shining a spotlight on the urgent need for member states and partners to raise awareness about birth defects and intensify efforts to prevent, detect, and manage these congenital anomalies that affect lives even before they begin. Thus today, we remind ourselves that every journey matters and that the journey to good health begins before birth. Children born with birth defects are not just statistics. They represent the loss of precious lives and the anguish and struggle of families. I am heartened that the regional implementation guidance on universal newborn screening of 3 conditions is being released to facilitate capacity building of member states. The 3 conditions are hearing impairment, eye abnormalities, and neonatal jaundice. Globally, the contribution of birth defects to under 5 child mortality is on the rise, with devastating consequences. In our region, approximately 300 children under the age of 5 years lose their lives to birth defects each day. This is unacceptable, and it demands our immediate attention and action. While genetics often plays a significant role in the causation of birth defects, many of these are preventable by addressing environmental factors. This includes exposure to pollutants, lifestyle choices, and socio-economic conditions affecting pregnant women and their unborn children. By tackling these factors, we can make significant progress in reducing the prevalence of birth defects and in saving lives. It was after the World Health Assembly resolution on birth defects in 2010 that our WHO Southeast Asia region, in collaboration with CDC USA, initiated a holistic initiative on birth defects. An integrated approach was adopted, embedding interventions for the prevention and treatment of birth defects within existing national health programs. This comprehensive strategy is yielding results, but our work is far from over. Accelerating prevention, management, and care for birth defects is a priority, and we are calling for actions in 5 key areas. Firstly, it is crucial to elevate the priority of birth defects on national agendas and bolster commitment and leadership at all levels. Financial resources must be allocated commensurately to support comprehensive prevention and management strategies. Secondly, the new regional document and videos on universal newborn screening of 3 conditions provides guidance on how simple tests can be integrated within existing health systems. The introduction of these tests should be supported by effective systems for referral, diagnosis, management, and follow-up. Thirdly, we must focus on improving coverage and quality of preventive interventions such as rubella immunization and food fortification. These efforts are critical in reducing the incidence of birth defects and ensuring healthier outcomes for mothers and their babies. Member states need to plan, implement, and monitor large-scale food fortification programs aligned with the 76th World Health Assembly Resolution 76.19, passed last year on food fortification. Fourthly, we must harness the power of community-based networks and organizations to support parents, caregivers, and families of children with birth defects. Empowering them to access essential services and support is essential in ensuring no one is left behind. Lastly, we must sustain and expand surveillance efforts to improve the coverage and quality of data collection and analysis. This data will be invaluable in guiding our efforts, mobilizing resources, and improving program implementation. Today, let us reaffirm our commitment to accelerate actions to prevent, detect, and manage these conditions. This commitment of ours is aligned with the Survive, Thrive, and Transform agenda of the Global Strategy for Women's, Children, and Adolescents' Health 2016 to 2030. On World Birth Defects Day, let us remember that every journey matters, and let us ensure a brighter and healthier future for all. Thank you.